I might kick off this evening. Thanks very much for joining the first virtual instalment of the Health Matters lecture series for this year. My name is James Ward. I'm the director of the UQ Post Centre based at St Lucia and a professor of public health in the School of Public Health at UQ. I'm your MC for this evening, and bear with us because we're in a new world where we're doing our lecture series via Zoom. Just a little bit about myself. I'm a Pinjarra and Nhmrc man from Central and South Australia. I grew up in Alice Springs and have big family connections all through Central and South Australia. And before I begin, I'd like to acknowledge the traditional owners of the country where you are tonight and where I am tonight. I acknowledge the traditional owners of the Turrbal and Jagera nations here in Brisbane. I acknowledge elders here with us today, those that have passed, those that are emerging, and anybody that's involved in Aboriginal research and the important role they play in responding to the needs and visions of Aboriginal communities in Australia. I'd also like to acknowledge our speakers this evening, our distinguished speakers, Professor Bronwyn Fredericks and Associate Professor Marie Toombs, both from the University of Queensland, who are going to talk us through Indigenous research, who is it really for and who does it benefit. So bear with us and we'll get going through the evening. So the way we'll run tonight, firstly, the Health Matters lecture series aims to showcase the life-changing, life-improving research work happening in and around the University of Queensland and offer you, our alumni, donors, staff, students and members of the public an opportunity to ask questions about important health issues. Those of you who have attended Health Matters lectures in the past will know that this is the first virtual lecture we have held, and as such, the format for this evening's proceedings differ slightly from previous ones. I can see that you're not visible or audible to any other attendees, so you don't have to worry about that. For the agenda tonight, we'll be hearing from Associate Professor Marie Toombs first, presenting on her research on why Indigenous health outcomes will only improve when we as Indigenous Australians lead the way. And that will be followed by Professor Bronwyn Fredericks talking to research translation and the impact research can have for our community. Both of these speakers are distinguished speakers, both working at the University of Queensland, both with stellar careers. Following the two presentations, we'll have a short Q&A with the panel, and which will provide you the opportunity to ask any questions of the speakers. Well, because we have a lot of attendees joining us tonight, and we thank you all for that. There's more than 460 registrations for this evening. We ask any questions that you may wish to ask are placed in the Q&A function down the bottom of the screen, not the chat function. We have a person, Natasha Rabbit from the UQ, who is moderating this for us tonight. And because we have a short period for questions, we'll ask you to upvote other people's questions so we can distinguish which is the most important questions that you'd like to ask of the panel. How you upvote is there, once somebody's asked a question, you can put a thumbs up next to that question, and then we'll prioritise the questions in the short period following both presentations. So I'd like to introduce Professor Marie Toombs, our first speaker tonight, who's the Associate Dean, Indigenous Engagement at UQ's Faculty of Medicine. Along with her role at the Faculty of Medicine, Marie has 20 years' experience in teaching Indigenous students. It was from this that she observed a pattern in young Indigenous Australians disengaging from education and has worked since to understand and help bridge this gap. Marie is heavily involved in Nhmrc projects focusing on mental health, suicide prevention and other chronic diseases. She's a member of the Australian Medical Council, as well as an advisory board member for St Vincent's Hospital and current chair of the Carbal Medical Service based in Toowoomba and Warwick. Marie's current projects include the Mob Van, a mobile caravan which aims to provide primary health care to Aboriginal communities around Toowoomba, and the developer of the ICE Assist, a culturally tailored training program established to address the increasing rates of suicide among Indigenous peoples living in rural and remote areas. Marie's pre-recorded, as has Bronwyn this evening, so I'm going to press play and hopefully this works.
I'm really excited to be presenting this evening, and my talk will be on why Indigenous health outcomes will only improve when we as Indigenous Australians lead the way. So just a little bit about who I am and where I come from. So I'm a really very proud Aboriginal woman, and on my grandmother's side we are Kuma, and unfortunately my family were removed from their peoples out between Cunnamulla and Bolan and placed onto Cherbourg Mission. And here's a photo of my grandmother, aunties and my great-grandmother here as well. And this was my great-grandmother, and she is very much the matriarch of our family and retained full language and and basically is the strength behind all the women in our family. On my paternal grandfather's side, we are Uralii, which is part of the Nhmrc Nation, and we come from a little community just outside of Lightning Ridge called Gaduga. So in the year since the RAP was launched, there have been significant developments in the national governance of research concerning Indigenous peoples. Notably, in July 2019, the Australian Institute of Aboriginal and Torres Strait Islander Studies released a consultation draft of the Code of Ethics for Aboriginal and Torres Strait Islander research. This Code of Ethics will be a mandatory code covering all Aboriginal and Torres Strait Islander research, including research activities to Aboriginal and Torres Strait Islander collections. Given these codes of conduct, I thought it pertinent to reflect on where we are thus far and to reflect upon what efficacy looks like when working with Aboriginal and Torres Strait Islander peoples, hereafter respectfully referred to as Indigenous Australians. According to Bainbridge et al., an ongoing question in Indigenous research discourse is whether the abundance of research conducted purportedly to improve health is justified and benefits Indigenous people in ways that are meaningful and valued by them. No one's discussing the elephant in the room, contemplating questions of research impact and benefit in Indigenous Australian health research. There remains a concern that Indigenous Australians have been over-researched without corresponding improvements in their health. So I'll give you an example. Take Cherbourg Mission, population 1,200, 2.5 hours west of here, and a common playground for health research. There are currently over 92 different services and research projects being conducted there right now, and yet the deliverables are poor. This is further augmented by services and researchers not talking and collaborating with the community. Whilst I'm sure that most of the programs at Cherbourg are being led with the best intent, with in some cases really great outcomes, there is a question here about efficacy and benefit-led approaches in the way that we conduct research that may also mean adopting less traditional Western methodologies that include an Indigenous standpoint. As a point of departure to improving impact and reaching mutually beneficial outcomes for researchers and partners in Indigenous health research, we really need to think about the benefit from the get-go of research and what role Indigenous communities, stakeholders and community members will have in these outcomes. So research conducted into why Indigenous participants do partake in research found that many participants will only participate in research if it benefits the communities in which they live, rather than for personal interests or gains. Participants often start from a position of caution and show a considered and deliberate process of decision making. in weighing up their decision to participate, some participants clearly articulate what they value, what they think of a project, and if it's important or not. So as mentioned at the beginning, we do have a reconciliation action plan, and as part of that, we are really focused on developing an Indigenous research strategy that really speaks to the Faculty of Medicine and to our researchers. So I thought what I would do for the rest of my presentation is focus on what I would consider, and I'm a little bit biased because of my studies, but focus on a couple of examples of where research has been conducted with Indigenous peoples and designed by Indigenous people, and the outcomes have led to translation. And that's really, really important in terms of vulnerable groups, and when we give people the tools to be engaged in their own research, what can actually be achieved. So I'd like to start with my first example, which is an Nhmrc grant that I was funded for back in 2014, and it was in response to a big Western driving trip that I took and just sat down and yarned with community over about 2 weeks, and during that time heard a lot about the major traumas that existed in these communities and an end point of suicide often being the outcome. And communities were feeling really frustrated about the fact that they didn't know what to do and they often didn't see the signs. And when a loved one became concerned about one of their loved ones, they found that often these services that could help were only available between the hours of 9 to 5. And often when someone's thinking about suicide, this isn't always going to fit into those timelines. So we got some funding through, as mentioned, the Nhmrc, and we developed a culturally tailored suicide intervention training program. And this one's actually really close to my heart because I went and did some suicide intervention training to understand what this type of training looked like. And just to set the scene, intervention training means that you intervene. So you don't become worried about a loved one or somebody around you and then ring for help. You actually take them through that process of finding out if the person is thinking about suicide, and if they are, hearing their story and then leading and guiding them to come up with steps to keep themselves safe for however long that might be. And so when I was taking this particular training, I became very aware that my brother was at risk of suicide. And I had known it, but I didn't know what to do about it until I did this training. And I actually sent him a text message because he wouldn't pick up the phone and asked him if he was thinking about suicide. And honestly, I looked and felt like a nut job. But this training was so impactful that I knew that if I didn't ask, then I could never live with myself if he did take his life. And as I said, he wouldn't pick up the phone, so I sent him a message and said, "Are you thinking about suicide?" And I'm thinking, I'm a lunatic, I can't believe this. But he came back with, "Yes, how did you know?" And with that, I was able to take him through this process of this training that I'd done, and that was it, I was sold. And so with that, we developed with communities our own training program that's really about efficacy. So we have trained over 321 people in this I-Assist training, predominantly Aboriginal peoples and predominantly community members. So Auntie Flo and the teacher that lives down the road, the sports, the footy coach. So people like that. But 320 in pretty much every community between Toowoomba and Rockhampton. And the outcome of that has been really, really powerful. So whilst this was a research project which has now gone into a full-blown program that we're looking at rolling out in Canada as well, what it did is it gave power back to those community members. And you'll see with the slide that I have up here on the screen that 65% of people after 6 months provided support, so they used this iAssist product at least once. So that's 321 participants, actually only 126 there we have results for. But I would say that that's very impactful research. And we've had people feed back to us also that it's given them the confidence now to not be afraid to speak about the word suicide. So yeah, I just think that's pretty amazing. We also developed a mobile app, and once again, designed by the communities that we worked in. And I honestly didn't think people would go for a mobile app, you know, but they did. And this particular app is to support those people who've done the training, so that if they get stuck and they forget a part of the training that they need to use, they can jump onto the app. And also, as I mentioned before, a lot of services are only open between 9 and 5, and particularly the more regional and remote that you go. And so this app was also intended to provide support to the person giving the intervention, so that they didn't feel like they had been left out of that process as well. So it connected training people with training people and participants with participants, and it was really effective. And here's some happy snaps of some of our participants, and yeah, it was just amazing to see the light bulb go on, like, oh my gosh, I can actually do this. The other really nice thing about this training as well, and I'll just go back, is that we also built in a train the trainer program. So we had 26 people do that. It was a 5-day training program. But the great thing about that too is it's a social enterprise model. So for those that did the training, they had to be on their P plates for 3 lots of training, and once they came off that, they could run their own training wherever they like. And some of those people have gone on to be national trainers and will work in other states and so on. But this group here, we're a group up in the Northern Territory. So we took this product up there and worked with this mob. And so as we did the training, we were always checking in to say, is this culturally appropriate? Could we tweak this? Could we do that? So that at the end of our research project, we would have something that was, yeah, top shelf. And we're hoping that Greg Hunt, the Federal Health Minister, will launch this in October. And just some more photos. This one was up in Rockhampton, but there were people there that had lost multiple family members to suicide. And yeah, so it was tough, but it was rewarding as well. So, okay, my second example. So this one here, and I talk about this a lot, so if you've heard this story before, I apologise, but I'm very, very proud of this project. And when I die, if that mob van, we call it, is somewhere sitting on my gravestone, I'll be very happy. But this is a From Little Things Big Things Grow type of a project. And whilst it wasn't funded by Nhmrc or one of those Category 1 grants, it was a Health Workforce Australia funded project. And the idea of this was to provide training for our medical and allied health students in regional areas or in an area of need as part of placement opportunities within the faculty. And it was also to provide primary health care to Aboriginal peoples. And so once again, consulting with community, yarning all over Western and Southwestern Queensland, and we found a community which surprisingly was not a remote community, but a community where there weren't a lot of services, and there was a lot of issues with not accessing local GPs and not accessing hospitals unless people were actually acute, because they didn't feel culturally safe. And that community was Warwick. So we took this van and Jeep down there after considerable argy-bargy and negotiating with the local council, the hospital wouldn't let us put this van there, even though we had a GP on board, nurses and health workers, and the only place that the council in the end agreed that we could place this van was in the local park. No security, and if it was vandalised, then it was on our head. So we thought we'd take a bet on it. And the other thing that council said is that we were wasting our time bringing this down to Warwick because there were hardly any Aboriginal people there. So anyway, we rised to the challenge, and we took this van down to the local park. And on the first day, we had it all decked out, and one elder went past and sort of had a bit of a look in, kept going, you know, may have looked over his shoulder, kept going. Next day, a couple of little Indigenous kids were in the park and they kicked their footy over towards the van so they could come over and have a little look. After about 2 weeks, we started to get people coming and using that van. At the end of 3 months, we had 300 people. At the end of 9 months, we had 1,200 people accessing that van, and we couldn't believe it. I knew that there was a big mob down there, but what I didn't expect was that people would come in and drive big distances to come and access this health service. And so we had people coming up from Toomala and Bogabilla, Gundawindi, Inglewood to come and see us because it was a culturally safe space. Fortunately for us, we were funded by the state government to set up a fixed clinic in Warwick. And this is the opening of the clinic that we eventually got funded for, and a couple of, one elder there. But that day was stinking hot, like you could hang a stick in the humidity. It was really, really hot. And that's the building on the left-hand side there. It's purpose-built. It has 3 GP rooms and a whole lot of nursing facilities. There's also a dental chair there as well. Not that we've ever used it because there's pretty good dental care down there. And I'm the chair of Kabul Medical Service, which actually ended up taking over as the provider. So it put the mob van out of service for a little while, but now what that van does is it goes to schools and it provides 715 health checks, which is a specific item number for Aboriginal and Torres Strait Islander peoples. And it also does hearing health checks, and because of that van and that service, there's now audiologists that have been placed up on the Darling Downs to support our children that have major hearing problems. So a success story as far as I'm concerned. So now I'm putting this last slide up here, not to big note, but my challenge here is this. So $15 million worth of research grants over the last 5 years, 4 of which I have run myself, and the others are projects that I'm involved in. But the question is, how many of these research projects will really and truly make a difference to the people that they're meant to make a difference to, and that's our Aboriginal and Torres Strait Islander peoples? How many of these will translate or transfer into government policy, training, jobs, capacity building, and all of those important features that research is supposed to contribute to? So I'm going to leave you with that question because some have, some haven't. Some are still in their different phases of being conducted. But under the UQ Reconciliation Action Plan and through a strategic planning day that I am organising for hopefully October, when the faculty can come together and plan where we want to go with our Indigenous research strategic plan, is to develop some really clear guidelines, some really clear pathways around building capacity and employment, and building our researchers as well in terms of Aboriginal and Torres Strait Islander people, so that within the faculty we can put our hand on our heart and say, hey, listen, we've done this well, we've shown feasibility, we've got output, and we are a provider that people feel safe to work with. So I'm going to leave it there, and I'm going to hand you over to our Pro Vice Chancellor, Indigenous Engagement, Professor Bronwyn Fredericks. Thank you.
Thanks very much, Marie. And it gives me great pleasure to introduce Professor Bronwyn Fredericks, as Marie just said, the Pro Vice Chancellor, Indigenous Engagement at the University of Queensland, who has been doing a stellar job of putting together a reconciliation action plan and implementing it across the university. And it gives me great pleasure to introduce Bronwyn. She's well known to many of you here in the audience here. Brahman has over 30 years experience working with the tertiary sector, state and federal governments, along with Aboriginal and Torres Strait Islander community health organisations. From 2016, she's got a very long track record, as you can imagine, but I want to just highlight a few. From 2016 until 2019, she was one of 2 commissioners with the Productivity Commission, the Queensland Productivity Commission, and was the presiding commission for the inquiry into service delivery in remote and discrete Aboriginal and Torres Strait Islander communities. Bronwyn's a member of the Australian Research Council College of Experts, the Australian Institute of Aboriginal and Torres Strait Islander Studies Research Advisory Committee, and the Beyond Blue National Research Committee. She was a research lead in the health node of the ARC-funded National Indigenous Researchers and Knowledge Network, Nhmrc, and I'll hand it over to Brahman, who, as you know, is a pre-recorded video.
Hi everyone, it's Bronwyn Fredericks here, Pro Vice Chancellor, Indigenous Engagement at the University of Queensland, and also proudly a researcher and scholar based at the University of Queensland. I want to begin my presentation this afternoon by thanking everyone for coming along, and also acknowledging the country that I'm offering the presentation on. And in terms of where you are and participating and listening from, to acknowledge the countries that you're on and all of the elders across those places, both past and present, in terms of advising research of the past, but also, and generating research of the past, but also part of research of the current times that we're living in. My presentation this afternoon will really focus on looking at research translation and the impacts and influence that research can have, and maybe how we need to think about some of these things in a better way, in a stronger way, to bring about greater changes or different kinds of changes beyond what we would think as the standard outputs of research, being refereed publications and conference presentations, and maybe generating a few reports and papers and working with HDR students. Not saying that's not important, it is, but there's other ways to bring about change, and I want to focus on that and encourage you to focus and be challenged by some of the things that I might say this afternoon. My presentation this afternoon will focus on who is it really for and who benefits. As I said, it's part of the Health Matters series for the Faculty of Medicine at the University of Queensland. I am going to speak about moving research to influencing policy, action and change, and ask some of these questions of you to ask of yourselves. Issues around research translation, impact, influence, looking at moving from will to willingness, and also strategy, and maybe thinking about strategy and how you employ strategy in what you do about your research translation. I want to start off with giving an example and also some insights that I gained from working on the inquiry into service delivery in remote and discrete Aboriginal and Torres Strait Islander communities. I was contacted in late 2016 and appointed as the presiding commissioner or lead commissioner for that particular inquiry. The inquiry was to look at what would work, what does work, and what works well, with a view to improving outcomes for Aboriginal and Torres Strait Islander people in remote and discrete communities in the state of Queensland, It did operate on a public inquiry model, or traditional public inquiry model, but it was also underpinned by a range of other strategies that we added in, and a range of other consultative mechanisms because of the nature of the inquiry, and because it was specifically working with remote and discrete Aboriginal Torres Strait Islander communities. In the process, we did work with over 500 stakeholders. These included councils, community leaders, service providers, government agencies, as well as individuals, young people, older people, all different groups. And we visited or met with every discrete community in the state of Queensland. Just to get an idea of the scope, roughly 1 in 5 Aboriginal and Torres Strait Islander Queenslanders live in a remote or a discrete community. It's about 40,000 people across those communities, and you can see them on the map there. Now, as we moved around, as I moved around as the presiding commissioner with the process, particularly in the Cape region, some of the other communities less so, but particularly in the Cape and the Gulf, I did hear comments made about researchers that were at a number of universities, researchers that undertake work across the whole service provision spectrum, whether it's in housing, women's services, range of services, land management, economic development, aged care, health, all kinds of services, but people undertaking research with Aboriginal and Torres Strait Islander peoples. I was also shown copies of the draft reports in terms of the QPC's draft reports, whether it was this later one, which was the inquiry into imprisonment and recidivism, or whether it was this particular report, draft report looking at remote and discrete Aboriginal and Torres Strait Islander communities, where community members, particularly senior community members, would ask me, where were the researchers? Where were the researchers' submissions? People who had undertaken work in their communities, putting in submissions to the inquiry, and the expectations that were there beyond the scope of just doing the research project, that they had taken evidence from their communities over generations in some cases, and years, where people had worked with some communities and not undertaking this type of role. When I did then later on visit some of those inquiries under looking at the imprisonment and recidivism inquiry, it got even more particular about the naming of individual researchers, and that a number of elder women said that some workers, research workers, whether they're project workers or the researchers or professors, were no longer welcome in their communities if they couldn't speak up on particular key issues such as this, and made comments about researchers getting their papers and getting their trips to Europe or elsewhere, and their promotions and their house repayments, but failed to do some of this. And that was a big learning for me. Maybe it should have happened a lot earlier than it did, and people had told me certain things, and I'd learnt things about giving back in terms of research. But this was so profound when communities came with their information and with their data and reports and articles that they'd printed off that researchers had written, but the researchers themselves did not do that. So I think there's lessons for everyone, and I hope that people who are listening here to my presentation gauge from that there are expectations out there that people will extend beyond the project and will use the information they have gained for their research and for research in the guise of making better or improving things for Aboriginal and Torres Strait Islander people, that also extends into other mechanisms, and I'll talk about some of that, how you may do that. I want people to think about taking stock of where you are. What are you doing? Look at what's really happening within the field, beyond the project. Don't just talk totally about the project or your project without actually understanding that it sits in a bigger context, whether it would have fitted into the one of these inquiries I've spoken about or something else. It sits in a bigger context of what is happening in the policy domain. And there is opportunities always to influence or to bring about your ideas from your research, your findings into that domain as well. Rethink who is involved in your work, who you are citing, and also how you cite. there is, in some of the work that's coming forward, and certainly some of the work that I read in these last 2 inquiries and some of my recent work I'm working on, there is quite an absence of new work in some of the citations. There's an absence of the emerging work, the new vibrant young scholars we all talk about. Where is their work being quoted? People do need to quote, sure, and reference the seminal works and the lead scholars in the field and build on that genealogy of thought. But that requires us also as scholars to be constantly looking at the emerging work, new work, elevating those new voices of those people that will come through. We keep talking capacity building. That also implies citing the work of those people coming through and how we build them into the process. Think about the range of platforms that are available for research, translation and disseminating your work. And I'll talk about those a little bit later. Want people to really start thinking about impact. How do you measure it? And impact for whom and what? Is it just about refereed publications? Is it just about journal articles? Is it just about refereed conference abstracts or grants won? And I beg to differ that it's not just about that. It is about other impacts. I was so proud of the team that I worked on with one of the women's groups in New South Wales, when one of the very small projects we took on, when no one else would take it on, either in New South Wales or the greater southeast Queensland area, to undertake a particular about the research evaluation for a group. And our report was later named in Parliament and documented in Hansard. That report assisted in that organisation making representation to government to secure nearly $1 million in funding, and then have gone on to secure other funding for that organisation for vital services for women around health and fitness, healthy eating, and also family and domestic violence. So really key cutting issues that women wanted addressed in their community. And I was able to work with some fabulous people in doing that too. We had fun, we had tears as well, but it was great work. So think about your impact, think about where you can make impact and who you influence with that work, and how do you want to influence. If you can't, how do you give that material to others to be able to utilise for them to be able to influence? And I think that's important too, is about knowing who those networks are or the key stakeholders are, to provide them with the information so that they can gain traction based on that research, based on those findings. And that's particularly of importance in the Aboriginal Torres Strait Islander health space as well, and particularly important around the policy space too. And I do want to stress that people can have all the good intentions in the world and all the goodwill in terms of saying, oh, I really wanted to do that, would love to do that, wish we could make a bigger difference. People need to change that willingness, the will, into the willingness and actions. People need to do more around the willingness to bring about greater change and difference. In terms of the Indigenous space as well, I will say people do need to start thinking about what works and implementing what works. There is so much evidence, so much material, so much that tells us what is needed. That needs to be embraced, that needs to be scaffolded off, that needs to be built into the programs, and people need to make commitment to what works, including in terms of research and evaluative research, to demonstrate it over and over, but also to build new forms of knowledge that shows why it works and how it works. Not consistently thinking that Aboriginal and Torres Strait Islander people are the problem that needs to be fixed. You need to look at what's working and build on that. I will also say that some of the lens of research does need to flick around, that the dominant culture or people associated with the dominant culture does need to think about itself in terms of how it sees Aboriginal Torres Strait Islander people and how it interprets and understands Aboriginal Torres Strait Islander health in relation to the mainstream health services. And some of that research needs to be done by non-Indigenous people about themselves. Once again, less focusing on Aboriginal Torres Strait Islander people as the problem. Some of this also needs to be built on ethics documents. I constantly see, and I saw that through the QPC, where some work was trying to avoid working through the ethics documents or not based on localised communities' terms of reference or how they would like the work to be carried out. People do need to follow through on the work beyond election cycles, beyond individuals, programs and initiatives. I'm not going to say too much. I think that's self-explanatory. People do need to look at the gaps and stop focusing on their main pet project or their main key area of interest, but look at the gaps in those areas as well and get on with the job of moving to the wilderness. I want to give some examples now of some of this that has happened at UQ. So I've only been at UQ now for 2 years, but I have seen really great examples of this happening. And I'm sure there's others, but we need to see more. So currently, recently, there was a group that focused on the food pricing and food security inquiry that's happening at the moment through the Senate. And that submission was only put in 2 weeks ago. And that was led through the public health area of the Faculty of Medicine with my office and also the Posh Institute, so the Posh Centre. So that's a really good example of people working collaboratively to get that done. Currently, there is the Queensland inquiry into the NDIS market in the state, and that's currently open for submissions. So I haven't seen anything come forward from people at UQ that may work in the disability space around that. Last year, we had a really great submission prepared, really great workshop and process around consultation between anthropologists, health people, humanities, traditional owners and other key stakeholders to get a submission up from UQ for the Cultural Heritage Act. And there's also some smaller submissions from different groups around the University of Queensland that put into the Productivity Commission's Indigenous evaluation work that they were undertaking last year. As far as I'm aware, there was no broad-based UQ submission for that, but there was different groups working on submissions. So different processes. Now, getting onto the multiple platforms that people can use, these are just some. They're not all, but they're just some examples that I've seen people use. Some use them very effectively, some don't. There's the traditional ones that we would think of in research, which is the referee journals and conferences. I will say that, you know, if people are only doing that and targeting that, that is so conservative in terms of the way to get your research out. And please don't think that there are people in the policy space just sitting there waiting for your next, bated breath for your next referee journal article to come out. They're not, but they may read things through these other mechanisms and then look for your refereed papers. So think about that. So there are public forums that people can participate in, roundtables, multi and cross-disciplinary work. I do know that in the Productivity Commission inquiry work, both on the imprisonment inquiry and additionally in the remote and discrete Aboriginal Torres Strait Islander communities inquiry work, we saw very few scholars and researchers come to the public roundtables or the public hearings or present at public hearings. That's another process that people have open to them where they present their evidence to the commissioners and to the commission through the process and to the public. That's an opportunity as well. It's all documented and recorded and people can quote from that work. There's also blogs, e-zines, magazines, newspapers, journals of influence. I do say to use these very carefully. You could get quite caught up in writing for all of them all the time and less focus on some of the other work, which could be also problematic. But I think some of those done in a measured way are good. There's also social media platforms that people can utilise. Be careful about getting sucked in. For me, when I discovered it, I was all over it. I loved it. And now I sort of go back and forth to it. And those other people become like social media warriors or keyboard warriors, they call them. Be very careful of that. Think about how you utilise it. Think before you post anything, even a blog, all of those things, about how you're using your platform and how you're using your voice. I know some people probably already do that, but others possibly might need to hear that advice. There's industry newsletters, letters to editors. People at all times need to remember, please, to draw on your research evidence. If you're using it for a research tool and not just for fun, not for something under a pseudonym, you know, not for part of your UQ work or your platform or your scholarly work. That's different. But if you're using it for your research and around translation and influencing, please draw on your research evidence. Don't get caught into the celebrity. I put that there because that's quite easily done too. People can become groupies to certain celebrity scholars or celebrity researchers. But, you know, I find it difficult when they extend themselves to comment on everything and not comment on their area of expertise. So that's just me. That's my personal opinion. Others would have different opinions on that. And lastly, be super creative. Be creative, and if you can, be super creative. There's always new things coming out. There's always new ways to disseminate your research. In the Indigenous space, we need to be thinking about a whole range of ways. I know certainly numerous communities have their own websites, they have their own blogs, and certainly with some of the past work I've done, whether it's community-based research, the inquiry work, we use those blogs, we use those sites, we used electronic billboards coming into town for announcements, or the days that there might have been a focus group for a community-based women's workshop or men's workshop or youth workshop or mixed workshops, a whole range of strategies that I've used. And you, I encourage you to be creative. It can add a whole other dimension of fun. Lastly, just to sum it up, I hope I've kind of put some thoughts into your head or questioned you to bring about some challenge around moving your research to influencing policy, to action and to change. And that you start thinking about research translation, how you may do that better, how you may do that more effectively, how you can have greater impact, and how you can have greater influence. I want you to think about looking at moving from the will to willingness in your work. Think about that. I've said that a number of times, so I'm hoping that it's imprinted in a way and that you really start reflecting on that going forward, and you strategize about what you're going to do about your research translation going from here on in. They're my contact details, my emails, and my Twitter handle if you want to have a look just to get some ideas. I'm not great, I'm not fantastic. There's lots of other people at UQ. There's lots of other Indigenous people that are phenomenal on this, and non-Indigenous people that are great at disseminating their research. UQ's got quite a few people on social media that I follow and researchers, and I'll give a shout out for some of them. There's Associate Professor Chelsea Bond, Professor James Ward, Professor Anita Heiss has some sort of fun and funky stuff from time to time, and some really serious scholarly work too. There's Associate Professor Sandra Phillips and others too. So please have a look for all of those and look for others too. Right now, I just say I hope you've enjoyed my presentation, and please contact me if you have any questions, but also after the session. But I'm also happy to take questions after the presenters today, and to hear some of the discussion that takes place too. Thanks, everyone.
Thanks very much, everyone. And I know that we're running a little bit late because we had some delays at the front, but we hope you can still join us for question and answer time. There are, I'll remind people that there is a Q&A button at the bottom of your screen. If you'd like any questions answered, please start typing away now. There are 6 open questions in there, and Marie has kindly answered 4 questions, pretty straightforward answers for about the use of the app and so forth. If you just click on the answered button in the top of the Q&A panel. So I'll ask, thanks very much for both of your presentations, Bronwyn and Marie. If you could just turn back on your camera so I can see you're there. And I'll probably start asking some of the questions that are on the Q&A screen that haven't been answered so far. Both of you talked very strongly about impact of research, and put very good examples in there of research that has impacted and research that hasn't. There's a question in the Q&A box, and a very good question about why so much effort, why so much dollars, but so little impact in our communities. I might hand it over to you first, Brahman, given your experience in across the sectors. Why do you think that's the case, and what? And the related question is, and what can we do better at UQ, and what have we got in place at UQ to help us make more of an impact in our research across our academics across UQ?
Thanks, James, and thanks for the person who asked that question. I don't know all the answers around that, and I'm sure many people who are participating tonight would probably got some idea too, and equally know that, as I do, that there is so much, as I said in my presentation, evidence out there. What happens is often that evidence does not translate into practice. I think in one part, we as researchers or scholars, whatever you call yourself, needs to take some responsibility there in how you try to get your message out beyond, as I said, refereed papers or journal articles in the Australian scene or internationally, as well as conferences, to try and push it out into other avenues, but also do some hard lobbying through your disciplinary bodies, your networks. And when you know there are things coming up, such as inquiries, as I've mentioned, to push into that space, I think in terms of UQ, we've got to do better in that space of advocating. We have to do better at actioning our outcomes rather than just constantly focusing on the next project and doing the research, getting the next project, the next grant. I know a number of people have written about why have we got so much research, why have we got so much evidence and it's not acted on. So, you know, that's a short answer. It could go on longer, but just have a look at what some people have written in regards to that.
Marie, do you want to add to that? Marie. So we appear to have lost Marie for a moment.
I think just I'll add to that. We wait for Marie, she might come back on. But I think too, we have to look at who's driving the research agenda at times, and it's not us. It's not the Indigenous people within research that drive the agenda. So people do need to look at why the agenda is being driven in its own way and whose interests is it serving in terms of the way funding is allocated and the way priorities are sometimes allocated and shifted, whether they're government priorities or whether they've come from the academies and the learned academies, or whether they've come through other mechanisms or round tables and how they come about. I'm not being naive there. I think that is in part a reality as well.
Just trying to get Marie back in. So
yeah, she may have dropped off. I was dropping off earlier as well.
Yeah. So I have another take on why we're having so little impact on research, and given I've been working at trying to address a very persistent issue in remote communities for a very long time. But I think that it's about the synergy of our efforts. I think the way that Nhmrc and ARC particularly fund research, it's for single interventions. And I definitely, after a very long period of research, feel that the single interventions always come up with a moderate impact on for our communities. But the burden of illness or the burden of disease is often too great for single interventions to make an impact. And unfortunately, we're stuck as researchers very much with trialling single interventions just because the methods and the quality of the applications that go in is so huge. And, you know, RCTs are usually single interventions. They're not synergized with a whole range of other interventions at the same time. So I think that's one. Similarly, the potency of our interventions is often not strong enough to make an impact on community incidence or prevalence. And thirdly, I think the other really, the white elephant in the room is that we're very fortunate that we get gifted in a very challenging environment. We get awarded grants from Nhmrc and ARC. but the accountability back to Nhmrc and ARC, not so much for all of us as researchers, I think is very minimal. And I see so many great applications come forward, and they're going to employ a lot of Aboriginal people, and they're going to do a lot of PhD students, but the accountability back to those institutions is very, very limited. And I think that is part of the issue with our communities. Maria, are you back now?
I don't think she's there.
Yeah.
I think if just adding on to what James just said, I remember in the late 80s, it might have been even into the early 90s, but the great Puggy Hunter, and he's long since passed on, did amazing work in community control sector, and there's the scholarship named after him that many people would know. But I remember hearing him speak, and him talking about our researchers dissect the body. Every aspect of Aboriginal and Torres Strait Islander bodies are dissected through research into small projects, and even components or one aspect of the body is then dissected. And I totally agree, James, in terms of that, in terms of the approach. Marie's back.
Oh, I got locked out. I'm like, let me in.
Sorry, Marie. We're just talking about the question about impact. Why we don't get great impact despite a lot of effort and a lot of dollars that go into Aboriginal communities through research.
Okay, I mean, my response to that is I don't think people really listen, or they really believe that the impact is what it is. And I can give you an example. We did a prevalence study a couple of years ago on the rates of mental health issues in regional and remote Aboriginal communities, and we had 544 participants involved in that. And we found the rates of major depressive disorder were actually 4.5 times higher than that of the national average. And we couldn't get that published in a journal in Australia. And one of the particular journals came back and said, well, can't you give us some good news? And it's like, well, actually, it's a prevalence study, and this is the data. And, you know, we had concordance with a psychiatrist as well. So it was a very strong study. And in the end, it was published in the BMJ, I think it was the BMJ Psychiatry, and it ended up being published in. So there is this element here of publication bias. But when we find results that perhaps don't fit with what Australia wants us to say, it can be a little bit problematic. And then I've had examples where I've presented, for example, on iAssist and on our suicide intervention training, and had feedback like, well, what do you mean the communities know what they want? Or what do you mean you go and you ask the communities? And I think, oh my gosh, we're 2020, 2019, 2018, and we're having to educate people around the fact that we do know what we need, and we do have solutions, and sometimes we just need to be heard. And there is an element, unfortunately, of paternalism that sits within this country where people think that they need to help us, whereas all they need to do is give us the tools to help ourselves, or listen to what it is that we're saying, particularly in this research space, because as Aboriginal researchers and non-Indigenous researchers would hear the same, but the community will tell us the solutions if we're prepared to sit down and take the time to listen. And, government need to listen to what we have to say, because we actually know what we're talking about.
I'm going to ask you to answer two questions very quickly, and they're very complex questions, but I'll go to Lenore Guyer's question first, which is about the process of building a mixed team of Indigenous and non-Indigenous researchers. Is there a place for this in the research community into the future? Your view, how to build that, and your thoughts on that. Should we be moving to all Aboriginal, or is there a role for...
I don't think so. I mean, part of the problem with Australia is we have a shared history that we don't know about. And so we have a shared history also in research. And I mean, some of my, most valued colleagues are non-Indigenous people. So it's about valuing the team, but I think it's about also acknowledging the strengths that Aboriginal people bring to the table. So, for example, I'm not a clinician, and my background, I'm a school teacher from way back, but my skill set is very much grounded in networking and deep listening, and being able to connect with communities in a way that can be done a lot quicker, and rapport developed a lot faster by virtue that I am Aboriginal. And so, you need a whole range of skill sets of people that come to the table so that we can, answer these really valuable questions. And I value my non-Indigenous research colleagues, and I don't think we can do this on our own, but there certainly needs to be an acknowledgement that as Aboriginal people, we need to also be leading projects, because often, we're placed at the bottom of the CI list for an Nhmrc grant, when in fact, through our ability to connect and build relationships, capacity, and all those types of things, that's often where the feasibility and the success of a project sits.
Sure. Brahman, there's a question for yourself. I might direct to you. So what sort of training or programs are there available to research academics at UQ to help sort through some of these issues around translation of research findings and engagement with Indigenous communities?
I think some of that we need to call on the Office of Research and the graduate school around doing some of that. Last year, we did run a workshop. When I say we, the Indigenous Engagement Division ran a workshop in partnership around supervisors for supervision of Indigenous HDRs, but there needs to be greater capacity around the whole spectrum. We are looking at, and this will move ahead, there'll be cross-cultural or cross-cultural competency training rolling out across the university from July. People may already be involved in some of the pilots at the moment that are happening around that, but that will move out fully July. Also looking at an ethics module that's being developed in partnership with the Australian Institute of Aboriginal and Torres Strait Islander Studies. And so I'm really excited about that. There will be us and the University of Sydney who are in partnership around that, but we're looking at then further rolling that out nationally. UQ, as one of the partner organisations, will have access to that training more broadly, and I would encourage people to sign up for that. But there is a lot more needed. People do need to seek out training, not just at UQ, but at other venues, through other institutions or organisations where it may be appropriate or specific. I want to say that if you want training and specific types of training, please raise it during some of the workshops that are coming up that you maybe have already put your names down for, as connected to the Indigenous research strategy that's being developed at UQ. That process is happening right now. I know that there's workshops that have already happened last week, there's some this week, next week. So please make that known, but also the particulars of that and anything else that you want to see in the Aboriginal Torres Strait Islander research strategy that will be part of UQ, because that will form the framework for us going forward. When I talk about working with non-Indigenous people, I want non-Indigenous people to do training and to have capacity building. The capacity building is not all about Indigenous people being capacity built. We've already heard how much money and qualifications Marie has. We've heard that from James. I could go round to Chelsea Bond, Sandra Phillips, Marnie Shea. I could go around and name everyone in all the Indigenous scholars in the university, and they've all got track records and experience and qualifications. Necessarily, it's not about our capacity building. It's about non-Indigenous capacity building too. And so part of that research strategy needs to frame that as well.
The final question I will ask of both of you this evening, and it comes from Neil R. Marie, you mentioned Cherbourg has 90 projects there, and the question is, does the community there, and I don't want to single out Cherbourg actually, because many communities all over Australia are facing this same predicament of being inundated with research studies in their communities. Perhaps to frame it a different way is, what's our responsibility as researchers to build capacity of communities, even in research processes? not to oversight research, to help inform communities about research methods and research outcomes that they should expect, research priorities within their community. What's our responsibility as researchers? I think we, as Aboriginal researchers, often do that without us even knowing that. But what's our responsibility as researchers working with communities to help build capacity?
It's everything. It's absolutely everything. And if we don't do that, we're going to continue to keep creating the same disasters that we continue to. You know, that whole method of madness is doing the same thing over and over and expecting a different different way of things happening. And you know, Sherbert's a great example. Like it's like 92 different programs down there. And the problem is, it's the research or the programs, it's all with good intent, but it's being done to the community. It's not being done with. So there's not that, you know, advancement in the community, upskilling. And, you know, and then there's another layer to this as well. And, you know, I'm kind of going off into fluffy land here, but until we acknowledge like the past history, I mean, a lot of the research that I do is around trauma, and we have to go back upstream and acknowledge that that has happened so that we can start to break this cycle of disadvantage. And it's something we can't answer this evening, but I think there's many layers in it. It's a multifactorial sort of a bit of a quagmire in terms of how we do address this, but consult, work with community. As researchers, it is our primary responsibility to make sure that, you know, the communities are completely involved in this.
I think, James, we've also got to look at, it's not just the number of research projects, but if you combine that with the number of services and service delivery organisations that are there. And in that first QPC report that I mentioned, there was, you know, community, it's named in the report, it's stated in the report. So I'm not breaching confidence here, but there's 400 people in one community of Cohen. There's 70 service providers or organisations just for that community, plus then all the research projects and projects. But it's very clear that people ring up organisations in communities, whether it's that one or others, and shop around for a community who will take their project. That is the universities and researchers need to take that on board, it's not about constantly Aboriginal shopping, that who they should be looking at for a discrete population to do the work. They also need to be looking at urban populations, and I'll say that very clearly too. The growth is to the urban drift. You know, the growth is in the southeast Queensland, where we know there are 60,000, 70,000 Aboriginal and Torres Strait People in southeast Queensland alone. There's, you know, how many people live in Alice Springs? How many people live in some of these communities that constantly, I hear researchers go, maybe they might be interested or they might be interested. So in that regard, I'd like people to turn the mirror back on themselves and ask, who is this really benefiting and what is the purpose of this? Surely there's perhaps an Aboriginal Torres Strait Islander group or collective on the north side or south side towards the coast that would really love this work, or a network of organisations across southeast Queensland, or in, you know, some of these other big regional areas as well.
Thank you very much for that last plug for Urban Indigenous Health Brahman, given that Director of UQ Post Centre, which is Urban Indigenous focused.
I'm urban too, you know.
Yes, thank you.
We're living in Brisbane.
Yeah, so I think we'll wrap it up now and let everyone resume their, what is it, Monday night, Tuesday night? Monday night, and enjoy television on the Monday night. And thank you all for your participation. Thank you very much to Marie and Brahman for great presentations. Thank you all for your questions and bearing with us during our first virtual instalment of Health Matters lecture series for 2020. We had a few small hiccups, but we got there in the end. So thank you for your persistence and patience, and we'll talk soon. Thanks very much.
Thank you, everyone.
Thank you.